Good afternoon, everyone, once again.
Good
Our
afternoon, ma'am.
able professors in the house and colleagues. Yeah, I welcome you to another session in our seminar series at the Center of Excellence in Migration and Global Studies. And today we have a very interesting presentation by some colleagues, both in and outside our own university. So, but before I go ahead to introduce them to you, let me say that on behalf of the Vice Chancellor, Professor Olufemi Peters, you are highly welcomed, and I am Professor Gloria Neto, the Director of the Center of Excellence in Migration and Global Studies of the National Open University of Nigeria. Let me tell you briefly, quickly, one or two things about our center before I start to introduce the speakers for today. Our Center of Excellence in Migration and Global Studies, was started about over 4 years now. We are getting older by the day. Over 4 years ago, by a seed fund, with a seed fund from Tech Fund. And we have been saddled with some responsibilities. And our mandates, let me quickly read them to you: to provide leverage for field-based and solution-driven research, to serve as agents of national policy for migration studies, to seek grants for academic activities and outreach for sustainability, to publish and sustain peer-reviewed academic journal and monograph series, to collaborate with stakeholders in the field and policymakers, to organize occasional seminars, conferences, and public lectures. I must say that we, of course, have our journals on. If you go to our sites online, just go and search CMDS, and you will find our site. Our journal site is there, and we publish an issue this year, our volume 4, issue 1, and we're going to publish one by November. So we publish 2 issues in a year. And I also want to let you know and announce to you that we are preparing for an international conference come February 2025, precisely 11th and 12th of February 2025. And it's going to be all encompassing everywhere in the world. That conference will be attended by people, and we are open to abstract submission, and it's ongoing. Abstract submission will close on the 15th of November. So do well to share with your colleagues and let everyone be part of it. And this one thing unique about this international conference is that it is free of charge. And you know that conferences are not held free of charge easily these days, but Center of Excellence is unique. Everything, publication, conferences, everything is free of charge. And we say a big thank you to our magnanimous Vice Chancellor for always being there for us. Having said that, because I know that we are going to have a very juicy talk today, I don't want to waste our time. Let's go to the business for the day. Today we have some researchers in our midst, and I'm going to introduce them one after the other. They are going to be talking to us about environmental factors and healthcare assets in communicable disease transmission and control among displaced populations, inclusive solutions for leaving no one behind. Yes, this is a very interesting one. And it is a research work that they carried out on the field. And so they are going to share with us. We are going to have three of them. And the lead person in this research is no other than our own head of Department of Environmental Health. At least as at now, she's still the head. I know she will tell me, oh, I'm no more the head, but she's still the head because no new one has been sworn in. And she is no other than Dr. Oluremi Saliu, a senior lecturer at the Department of Environmental Health Sciences at the Faculty of Health Sciences, National Open University of Nigeria. Let me quickly tell you, read her short biography so that we know more about her. Of course, like I told you, she's the head of Environmental Health Sciences. She's been there for about 4 years and has done beautifully and wonderfully well. And she had her degrees. The first degree she had at the University of Lagos in biochemistry, and of course, master's from University of Ilorin and PhD from University of Ilorin in medical parasitology and toxicology. Her areas of specialization include phytomedicine, environmental toxicology, and public health. She's a fellow of the Occupational Safety and Health Association, United Kingdom, fellow of the African Institute of Public Health Professionals, member of Parasitology and Public Health Society of Nigeria. She's also a registered environmental health officer with the Environmental Health Council of Nigeria, member of Nigerian Society of Biochemistry and Molecular Biology, member of Science Association of Nigeria, member of International Society of Environmental Epidemiology, member of Organization of Women in Malaria, member of Organization of Women in Science for Developing World, member of Royal Society for Tropical Medicine and Hygiene, member of American Society of Tropical Medicine and Hygiene. And the list continues. So we have a guru in our midst, a very well-learned scientist, and I'm very proud of her. She's my friend. I've known her as a very hardworking person, and we are happy to have her here, and as the lead researcher in this research that we are going to present today. Married to a renowned doctor at the National University Commission, Dr. Biodun Saliu. And she told me that she likes cooking. So after this presentation this afternoon, I think we'll converge in her office to go and taste some of the food she has for us. So, well, I was going to introduce Dr. Idowu, who is also a lecturer and researcher at the Department of Environmental Health Science, Faculty of Health Sciences of our own precious university, National Open University of Nigeria. Dr. Idowu read, he said he's a prince of Sogla University. And he earned his PhD in biochemistry too, with a specialization in phytomedicine and toxicology from the University of Ilorin, Kwara State. He's a member of the Nigerian Society for Biochemistry and Molecular Biology. Dr. Idowu's very passionate about cutting-edge scientific research in the areas of epidemiology, communicable and non-communicable diseases as it concerns global health. Dr. Idowu is not only well-equipped to develop basic research to add knowledge in the scientific space, but also to apply studies to answer questions related to the interaction between the environment and health. He has supervised students in both undergraduate and postgraduate levels in the fields of biochemistry, environmental health science, and public health. Dr. Idowu has published a number of articles, books, and chapters in books in so many journals, both national and international. And he's a grounded researcher, as he has said, and we know that we have read many works of his in the social media. So, Dr. Idowu, you are welcome, and we are privileged to have people like you here today to talk to us about this research that we have all been looking forward to hearing from you. So we really appreciate your presence.
Thank you, Prof, for having me. Thank you so much for having me.
The last but not the least is Dr. Olufunke Alaba, who is an economist with a PhD in economics and a postdoctoral fellowship in health economics from the University of Pretoria. You can see this is a collaborative research, and that makes it very interesting. Without listening, I'm already excited, Currently, she serves as a senior lecturer at the University of Cape Town's Health Economics Unit, School of Public Health, University of Cape Town, where she focuses on research and teaching related to health economics, social determinants of health, and poverty. Dr. Alaba has collaborated with various international organizations, including the World Health Organization, and has conducted significant empirical studies on health impacts and economic issues in Africa. Her extensive publication record includes articles in peer-reviewed journals addressing topics such as health insurance, food security, and socioeconomic inequalities in health outcome and malaria. So we are very happy today to have this wonderful team with us. And like I said, it's all about malaria, IDPs, and public health. And I'm very happy to have them here. And I have made each of them a co-host. So I'm going to just advise that the lead speaker will introduce the parts that each talk about. I guess you will set the ball rolling and tell us, what the others will talk about this research, that they've carried, on. So I will want her to share her screen if she wants to, but if not, it's fine. She's going to tell us why they went into this research and just give us a brief summary of this research so that we can follow and then present to us the aspects she wants to tell us about, while others will also. So we are going to listen now to Dr. Saliu, who is going to set the ball rolling concerning these environmental factors and healthcare access. I want to let you also know that each person will have maximum of 15 minutes to present. So get ready, 15 minutes for each person, after which we'll now go into the question and answer session. And when we are asking questions, we will let you know if you were to respond immediately or you wait for questions to collectively come for each person or for the team, and then we now have responses. But please, it's 15 minutes per person. So Dr. Saliu, over to you, ma. Your topic again of this research, you said, is environmental factors and healthcare access in communicable disease transmission and control among displaced populations, inclusive solutions for leaving no one behind. So over to you, ma'am. Yeah.
Thank you very much, Prof. Thank you so much, everyone. Good day, everyone. My name is Dr. Oluremi Saliu, as Prof has mentioned, from the Department of Environmental Health Science, Faculty of Health Sciences. I want to appreciate my chief host, that's Professor Olufemi Peters, the Vice Chancellor of the National Open University of Nigeria, and also my host, Professor Gloria Ameto. Thank you, everyone. All other protocols duly observed. I welcome you to this symposium titled Environmental Factors and Healthcare Access in Communicable Disease Transmission and Control among Displaced Population, Inclusive Solutions for Leaving No One Behind. As my host has mentioned, we are three on this discussion, and my aspect is actually focused on the disadvantaged populations and environmental factors influencing their vulnerability to communicable disease. And so I would just want to share my slide. A minute, please. According to WHO, disadvantaged groups refer to populations that experience higher level of social, economic marginalization. The total number of displaced persons has been on the increase, over 51% increase for the past 5 years. In Nigeria, over 3.3 million people have been displaced because of violence, insurgency, especially in the north, where we have a lot of insurgency. So there's a lot of this issue of displaced persons all over the country. In Nigeria alone, we have 3.3 million people being displaced from their abode, their initial abode. So we find that the issue of displaced people is becoming a challenge in Nigeria. And so in Abuja here, we have a lot of displaced people. We have the people from different IDP camps. We have like 5 IDP camps in Abuja here. And we notice that these IDP camps are filled with women, children that are not having access to the necessary things of life. And so we, as a team, we decided to work on do a research concerning this challenge with these displaced people in Abuja here. I'm sharing a video now concerning the challenges with these women, and especially in the IDP camp. This is Kabusa IDP camp, and as a team we went there. We went to assess the deficiencies in healthcare. I'll just leave you to listen to this short video. This is the IDP camp in Kabusa, and this is where we went to look at and investigate concerning malaria in this camp. The volume should be up. Okay. You can see the women there. Okay. Yeah. This is one of the camps in Abuja here. Actually, there are about 5, but I just picked this to showcase what happens within this camp. This is a typical IDP camp within Abuja. You could see the children, the women, a traditional bath attendant. She's the one that takes the bath for all women over 2,000. No support, no healthcare services, no formal training. I had a time to interview her concerning how she actually does what she does. And she was able to explain that here, nobody is training her. She trained herself. She decided to be helping the women. Community-based organizations are not supporting. And so you find out that this is a major challenge. The environment is filled with bushes. So we're able to administer and test for malaria among this community. And we're able to test the environmental challenges they had. We made sure we noted it. Yes, she's the women leader in that list. And she gave her own perspective concerning the challenges they had. They were not, they are from Borno State. Said there's nowhere to stay. They are in communities. Crowding, overcrowding is one of their challenges. No healthcare. In this IDP camp, there's not even one single healthcare support for them. No healthcare center at all. They have no food. They try to source food by begging, by soliciting, you know. So many challenges. Malaria is one of the major challenges they have. As we all know, malaria is endemic in Nigeria. Well, that's a short video. I need to move to the next slide. So you can see from this video, the vulnerability of these IDPs. They live in overcrowded camps. There's no shelter. There's no access to clean water. The combination of this usually makes these IDPs quite vulnerable. Let's look at the definition of communicable disease. You know, we say that a communicable disease is one that is spread from one person to another through a variety of means. For example, from blood, from bodily fluids, from breathing in an airborne virus, or by being bitten by an insect. So within these camps, we have a lot of common communicable diseases. A major one is malaria. The environmental factors like stagnant water. The picture beside this slide, you can see stagnant water. This is one of the IDP camps in Durumi. You find these displaced people are often unable to access mosquito nets, proper medical treatment, leading to higher rates of infection. Cholera is another major challenge. In Nigeria, we had outbreak in the base cities, that is in Borno, Adamawa, Yobe. Even this year, just this September, outbreak is highly contagious and can spread easily, resulting to death, even within these IDP camps. We also have the tuberculosis is a major problem or challenge within these camps. Measles, because of the close proximity, you have a lot of children with measles when there's an outbreak. Inadequate vaccination is another challenge, especially because we have a lot of children that are malnourished. These are the vulnerable groups. And so the exposure to all these communicable diseases are a major challenge in these displaced people's camps. What about environmental factors? They are major determinants in the health outcomes of these people. Both natural and human-made environmental conditions can contribute to the spread of these communicable diseases. Overcrowding. From what you have watched now, briefly, you can see that it's a typical situation, overcrowding. This became a major challenge during COVID, where it was mandated that people should have distancing, social distancing. That was not obtainable concerning these IDPs. Research during COVID by True Love et al. 2020 showed the extreme risk faced by these IDPs because of overcrowding in the camps. We also have poor sanitation, very obvious. Open defecation, that's the major challenge. There are no proper toilets, so it's a case of open defecation. No proper and insufficient sanitation, hygiene facilities amongst these people has led to the increase and spread the communication of communicable diseases like all these waterborne diseases, typhoid and cholera. They have limited access to clean water. Most of the IDPs we went to, they don't have clean water. The only one that seemed to have a bit of a better situation, the Wasa one, they had borehole water, but the water, when we did the research on it, found out that it was full of lead. That's another challenge. So these are the areas that are a bit of a challenge concerning the transmission of communicable disease. Malnutrition, food insecurity. I'm sure my colleague, Dr. Alaba, will talk more on this. Already they have weakened immune system that makes these individuals more susceptible to infectious diseases. Malnutrition can exacerbate several diseases like measles, tuberculosis, particularly in children. Those are the vulnerable groups, even within these camps. And so you find out that they are more susceptible to these communicable diseases. They are also exposed to harsh environmental conditions. When there is a flood, and you find out that in these camps, flooding can be a major challenge. For example, in Borno State, there was flooding this year. And because of that flooding, there was an outbreak of cholera, which really affected the IDP camps within that setting in Borno State, because we also have IDP camps spread across Nigeria in different states. These people have been displaced by insurgency, by different natural and man-made challenges. Inadequate healthcare services, very key. Limited access to healthcare facilities, including vaccines, treatments of diseases, no healthcare. They lack proper healthcare infrastructure. According to that video that I showed, I hope it was a bit clear. That was why I was just trying to talk along and give a general overview of what was happening in the video. The lady was able to explain to us that there is not even one primary healthcare within that IDP camp. And therefore, there's a difficulty in even diagnosis and treatment of communicable diseases within the camps. What are the strategies that we can put in place to enforce efforts to reduce the vulnerability of these people? Addressing environmental and healthcare challenges is critical in improving the healthcare outcomes of these displaced populations. Strategies will include improved wash infrastructure, water, sanitation, and hygiene. Waste disposal facilities, they are essential to prevent waterborne diseases. Provision of proper toilets can really go a long way strengthening healthcare system, mobile clinics, immunization campaigns. Community health workers can be deployed to these camps, to help these people. Vaccination programs, immunization campaigns, targeting diseases, communicable diseases that are often resident in these camps, like measles and cholera. Vector control measures. These are areas that can be looked at to reduce the vulnerability on transmission of these communicable diseases. For example, implementing mosquito control by distributing insecticide-treated bed nets and spraying insecticides can actually reduce the risk of malaria. And as we all know, malaria is endemic. The risk of transmission is even higher because of stagnant water and the environmental challenges within these IDP camps. Other strategies might include shelter, provision of adequate shelter and nutrition, strengthening disease surveillance and response, supporting this group of people, these disadvantaged groups, by providing psychological services and even having community engagement and health education within these groups. What is the conclusion? I would say that these IDPs face significant health challenge due to their conditions, which can foster rapid transmission of communicable diseases. Addressing these environmental and structural factors can contribute to this risk contribute to their improving their health outcomes by improving their environmental and even their providing clean water, sanitation, and healthcare. The tendency is that this would actually prevent the transmission and actually improve the quality of life for these displaced people. Thank you very much for this opportunity to discuss the challenges of this very interesting topic on this IDP camps. Thank you. I want you to also note that during the research, we obtained ethical approval from the Ministry of Health here in Abuja. On that note, I would like to thank my host and also hand over to the next speaker who will be talking more on the area of research in these IDP camps.
Thank you very much. Thank you, Dr. Saliu, for that presentation. I allowed you to take a little more than required because of the initial internet challenge. So without much waste of time, I want to call on Dr. Idowu to make his own presentation.
Okay, thank you for having me. I want to use this opportunity to also say a big thank you to the Vice Chancellor of the National Open University of Nigeria. I also want to thank the Director of Center of Excellence for Migration and Global Studies for this opportunity to present on the environmental factors and healthcare access in communicable diseases transmission and control among displaced populations, inclusive solution for leaving no one behind. Yes, I'll be talking about the challenges faced by the displaced people, particularly the internally displaced persons, in accessing healthcare system for the control of communicable disease in Nigeria. Now, who are displaced populations? Displaced populations are a group of people or individuals who are forced to migrate out of their habitual residence or homes, maybe because of conflicts, as in the case of communal clashes or elders and farmer clashes, like the situation we have in Nigeria. They could also be displaced because of terrorism and war, which is one of what the world experienced between Ukraine and Russia. And also even in Nigeria, we have the issue of the Boko Haram, which have caused a lot of people to be displaced. Also, natural disaster is another major cause of forced migration internally. This natural disaster could be in the form of flooding and earthquake and so on. Also, climate change can also affect people, causing them to migrate or to forcefully migrate out of their homes or habitual residence. And in most cases, when these people are being displaced because of the level of poverty, some of them cannot get a decent home for themselves. And majority of them end up in internally displaced persons camps. Now, internal displacement. Of course, when we talk about the internal displaced people, they are the people. Why internal displacement is the event that causes the forced migration of these people out of their homes. Internal displacement refers to the forced movement of people within the borders of their country. It is also the overall concept of people being displaced inside their own country. Internal displacement may be new or may be multiple, in the sense that we could have people who get displaced for the first time. Maybe they are displaced because of natural disaster or maybe because of conflict. And we could also have multiple internal displacements, such that people who are forced to flee from their homes to a particular displacement camp may encounter another reason for them to migrate forcefully. Maybe they've left their initial camp because of natural disaster or maybe because of conflict, and then move to another displacement camp where there is occurrence of conflict. This may cause them to also become displaced, and that's what the multiple displacement is all about. Now, what is the global picture of displaced person? According to Alexander Bally, who is the founder of the International Displacement Monitoring Center, she said that no country is immune to internal displacement. And the issue of internal displacement is almost becoming it's almost becoming like a pandemic. It's a global affair now, because over 100 countries have been affected. As at the end of year 2023, according to the IDMC, we have approximately about 76 million people who have been displaced globally. And this rise or this number of displacements has been almost been a consistent increase for almost a decade now, especially from year 2017 to year 2020. As you can see in this slide, projecting the figures of internally displaced individuals. So in year 2023 has recorded the highest number of internal displaced people when compared to 2022. And it will be interesting to know that African country, particularly Sudan, leads the chart of these internally displaced people. Next to it, it has about 9.1 million displaced people. Next to it is Syria, and after Syria, we have Democratic Republic of Congo taking the lead, while we also have some part of the Middle East, like Yemen, also having a quite high number of displaced people. So it has been reported that from the 76 million people who have been displaced globally internally, about 68.3 million of them were being displaced as a result of conflict and violence, while 7.7 million people have been displaced due to natural disaster. Now, what is the global report of internal displacement in Africa? The sub-Saharan Africa takes nearly half of the total number of people who are displaced globally, having a figure of about 35 million. And out of these 35 million, 32.5 million of them are being displaced by conflict and violence, while 2.3 million are being displaced as a result of disasters. With respect to the cause of the forced migration, it was reported by the IDNC that that at the end of 2023, there were 19.5 million internal displacements, which 30.5 million of it was caused by internal displacement due to conflict, and 6 million was caused as a result of natural disasters. In this number of this internally displacement, it will interest you to know that Nigeria in sub-Saharan Africa, Nigeria occupies the 5th position, where Sudan is the first. Next to it is Democratic Republic of Somalia. After Somalia, we have Democratic Republic of Congo, we have Ethiopia, and then Nigeria being the 5th country with the largest number of displaced persons in Africa. Just like my HOD said, at the end of year 2023, we have approximately about 3.4 million displaced persons in Nigeria. And out of these 3.4 million people that have been displaced in Nigeria, we have about 3,340,000 who have been displaced as a result of conflict, while just about 81,000 have been displaced as a result of a natural disaster. As you can see in this chart, that Nigeria occupies the 5th country in Africa with the largest number of displaced persons. Now, what is the overall situation of IDPs in Nigeria? There are over 209 IDP camps in Nigeria. Are mostly allocated in the northern part of Nigeria, and most of them have been displaced since 2014. Displaced persons are majorly from the northeast, like Adamawa, Borno, and then we also have those that have been displaced from northwest and the north central. And most of these camps are majorly made up of 25% women of the entire population, and then the ratio of girls to boys is around 3:1. Almost in every camp household. Now, major challenge faced by the IDP. Of course, my HOD has said a lot about challenges faced by the IDPs, but everything encompasses in the fact that these IDP people have faced the issue of neglect. We discovered that from our field work that they feel to be neglected by all hands. And then because of this, the fact that they are neglected, they become vulnerable to many issues, such as communicable and waterborne disease like malaria and measles. Communicable and waterborne diseases like malaria and measles, waterborne diseases like cholera, non-communicable disease like liver disease, cancer, and sexually transmitted diseases. And not just that, they also face higher risks of abuse. And this vulnerability is being compounded by a lot of factors, which I just highlighted some here. And this includes environmental factors as said by my head of department, lack of access to clean and potable water, and then we also have weak healthcare systems. So these are part of the challenges that are faced by this. However, everything encompasses in the fact that they are being neglected. Now, in terms of healthcare system for the control of communicable disease, and not just communicable disease, during our visit to the IDP camps, particularly in Abuja, here in the Federal Capital Territory, we discovered that in most of the IDP camps, there are absence of healthcare. Even where those that have healthcare, some of them do not even have manpower. They don't have professionals who could stay and attend to these people. And for those that don't even have, we discovered that they have to travel a mile to go and get access to health. So, because some of the primary health centers that are located within the federal capital area, especially some that are within some of these IDP camps, we discovered that they are very remote, they are very far. So accessing healthcare, either accessing care in terms of health and even the healthcare facility has become a major problem for these displaced people. So like I told you that we also have inadequate caregivers and maybe because of the fact that some of these IDP camps are situated in remote places, they find it difficult to get health caregivers or healthcare professionals. However, this is not only peculiar to the IDP people, it's also an endemic situation in Nigeria because of this JAPA syndrome and the brain drain that we have in the health sector. So another major health challenge they face is inadequate and proper health infrastructures. Like I said, that even those that have healthcare facilities, you discover that they are not well equipped. There is no power to use some of the health facility, to use some of the health facilities and even the medical gadgets that are present. And also the economic cost of healthcare. Of course, we know health is very, very expensive. So getting some of these medical items, medical needs of these people is very, very expensive. So these are part of the challenges that these internal displaced people are actually facing with respect to our visit to the IDP camps in Abuja. Now, the Sustainable Development Goals number 3 and number 6 calls for universal, equitable, or for good health and well-being, as well as access to clean water and sanitation, respectively, for all by 2013. Also, we also noticed that while there is a handful report of publications on communicable and non-communicable diseases, sexually transmitted diseases, and the water quality assessment, especially for non-displaced people, not only in the federal capital territory alone, but as well in the nation, Nigeria. However, we discover that there is paucity information in this regard, particularly as it has to deal with the IDP people of the federal capital territory. So in line with the Sustainable Development Goals, and for the fact that there are no handful information regarding the situation, particular health situation and environmental situation that these internal displaced people encounter. Our research group recently, for the past 3 years, has been focusing on some of the challenges that are being faced, some of the challenges that are faced or that the internal displaced persons are encountering. This our research team, which is being led by my amiable head of department. So we have been able to do some research in some of these IDP camps that are present in Abuja, and then share some of the things we have done, and then some of our outcomes. Part of the work we have done in these IDP camps is the prevailing rate of malaria among pregnant women associated and the associated environmental risk factors in the IDP camps. We, as a researcher, we do not only engage in this research, we also involve some of our postgraduate students. In fact, this study basically was carried out by our postgraduate students in the Faculty of Health Sciences. But we are able to supervise them. So this slide is showing some of the IDP camps they visited, and then some of the IDP camps they visited, and then they were able to carry out tests, and we discovered that the prevalence of malaria was quite high among these pregnant women. Not only that, we also investigated the prevailing rate of malaria in the 5 children, and also the associated risk factors. also being conducted by some of our postgraduate students, which we supervise. We also discovered that, in fact, in the children, almost about, in all the camps, more than 50% of the children which are under 5 years of age have malaria. And this, of course, is a reflection of the health status of the IDP camps, of the IDP people, or the internal displaced people, due to the fact that they don't have access to some of these health care to go and, to be tested for some of these communicable diseases, and not just communicable diseases, non-communicable diseases as well. Also, we have also conducted research on the heavy metals and the bacterial contamination of the source of drinking water, particularly for the Wasa IDP camp, because the Wasa IDP camp is the largest camp in the federal capital territory, hosting almost about 7,500 internal displaced persons. So when we conducted this study, the previous study on malaria has been completed, and is under review for publication. But the study we conducted on the heavy metals concentration for the drinking water from Wasa, we discovered that there were high concentration of lead, cadmium, and zinc. And not just that, we also did the bacteria assessment, and discovered that we are able to isolate bacteria like Enterobacter, Salmonella, and the Proteus bacteria from this water. And this paper was published sometime around June this year. Also, after we had discovered that the water source from the Wasa camp contains heavy metal, so for public health interest, we had to go further to evaluate the toxicity or the safety prior to safety evaluation of this water on the experimental
in the next 1 minute.
So we are able
next
to
1 minute.
Yes. Okay. So we are able to discover that this water, not just apart from the fact that it contains heavy metal, it was also able to cause alterations in biochemical parameters like liver enzymes, liver and kidney function indices as well. So because of the fact, what the WHO aim is that the WHO recommended that the use of vector control and also the use of insecticide nets can be a good use to reduce the prevalence of malaria. And because malaria drugs are expensive, so in our research team, we were able to come up. We are currently doing a research on how to get how to build plants that has a product from Lupus indica and Jatropha tandoja, which have been established to have anti-malaria. So we are currently conducting a research on the laryngeal activity to see if this product will be able to stop the metamorphosis of the mosquito vector from its larval state to its adult state, just to ensure that we're able to reduce the prevalence of malaria. So this research is ongoing. We also have our current MSc students who are also currently in the field now. They are in the 5 IDP camps where they are conducting a study on hepatitis B as well as syphilis. So I want to end with the word of Alexander Villard that says that no country is immune to disaster displacement, but we can see a difference in how displacement affects people in countries that are prepared and plan for its impact and those that don't. We also have an initiative which is being pioneered by the head of our department. We call it Neglected but Not Dejected initiative. So we want to use this medium to seek for collaborators, people who collaborate with us, who help us to see how we can address some of the challenges faced by these internally displaced persons. Thank you for having me.
Thank you very much for that wonderful submission. Thank you. Let us call on the last speaker, but not the least, Dr. Olufunke Alaba, to say how of this study. Over to you, ma'am.
Thank you. Let me share my slide.
Stop sharing, Dr. Edo. Stop.
Okay, I will.
So my name is Olufunke Alaba. I'm an associate professor at the Health Economics Unit in the School of Public Health, University of Cape Town, and I'm an economist. So I'll be speaking more in terms of the inclusivity and the economics behind the IDP people and communicable diseases. So as an introduction, because we've actually heard a lot about the introduction of the IDP, by Sui Ko, he says mitigating potential communicable diseases in refugee potential population is a subset effort for human rights, equality, and dignity. So this research study has to do with human rights, it has to do with dignity, and it has to do with equality. And that's why we are linking it to the SDG core principle of leaving no one behind. And looking at this study, this research study, you find out that it actually speaks to more than five SDG goals. That includes the SDG 10 in terms of reducing inequality, SDG 4 in terms of education, SDG 5 in terms of gender, SDG 3 in terms of healthcare, SDG 6 in terms of clean water, sanitation, and SDG 1 and 2 in terms of poverty and hunger. So when we are talking about leaving no one behind, is inclusion, and it talks to dignity, eliminating inequalities in all aspects. So as we have had, I'm not going to emphasize this. We already know that there is a high increase in internally displaced people, both in the globally and in Nigeria. And Nigeria actually ranks the 5th, as we have had. And so this is a cause of a concern in terms of global health and in terms of meeting the SDG goals. So as we have heard, I'm not actually going to, we've talked about the different challenges that actually internally displaced people are facing, including legal and protection gaps. So these people have no legal status technically, and so they are not protected. It's no wonder that you find out that in the camps there is such rampant reproductive health problems. So included in these challenges is also the insecurity. And much more of what we are talking about is the intersectionality. And when we talk about intersectionality, is a multitude and intersection of all these challenges, including the problem that you are already in the minority, but at the same time, you are in a space where you don't have the legal help. So communicable diseases among IDP camps. IDP camps are often overcrowded, as we've seen. The sanitation level very, very bad. And a research actually shows that in IDP camps, 97% are influenced, malaria is what causes 97%, cold, 65%, heart diseases, actually, prevalence has 56%. In a study in Colombia, looking at internally displaced people, comparing that to population at large, shows that malaria is 4.1 times higher amongst internally displaced people compared to the general population. And the mortality rate is 8 times more than, double of that of general population. And this actually is also collaborated with the study that we are just recently completed looking at malaria in IDP camps among pregnant women and among the under 5 children, which shows that the prevalence of malaria for under 5 children is up to 69.19%. And we find that the interesting thing that we find out also is the fact that the mothers are 50% of the mothers, or more than 50% of the mothers, are actually
I don't know,
under 18 years of age. And so when we talk about social determinants of health, when we talk about social determinants of health, we are talking about the place where people live, where people grow, and where people work. And so this shape the vulnerability of the internally displaced people to communicable diseases, because where they are living is already compromised. Their living environment is compromised. Their housing is compromised. The water and the sanitation is already compromised. And so this actually exacerbates and makes them more susceptible to infections. So I'm just going to talk around the specific social determinants that is associated with internally displaced people and makes them more vulnerable to communicable disease. One is overcrowding. Overcrowding actually allows the spread of airborne diseases. And we could see that during the COVID period, because they couldn't even have that space of the space that is expected by the law. The poor sanitation leads to cholera, and there is little or no water access. Actually, in all the camps we had, there was zero sanitation, good sanitation. Then limited healthcare access. Malnutrition, which weakens the immune system, increases susceptibility to pneumonia, measles. Economic hardship actually makes it to be unaffordable to have access to healthcare. And then we talk about the environmental stress and the psychosocial stress, which unfortunately is not something that needs to be researched amongst internally displaced people, because it weakens their immune system and increases their vulnerability. And so I move away a little into what we call the structural and economic determinants that shape communicable diseases. And when you talk about structural determinants, this refers to the underlying social and economic systems that actually shape health outcomes. So this actually now goes beyond the individual. So when we look at the IDP camp, for instance, there's limited resources because of the insufficient funding. There is chronic underfunding and there's the competition of resources. So the resources are limited. And as an economist, we all know that there is always an opportunity cost associated to our resources. So even the donors are fatigued with protracted displacement situation. Now we looked at resource allocations. These are structural determinants that actually exhibits the problem of communicable diseases among internally displaced people, because it's also difficult to balance immediate needs in terms of food and shelter with long-term health investment. Then there's an uneven distribution of resources across different IDP settlements. And that is not surprising, and which we observed in Abuja, because based on those 3 IDP camps that we went through, we found that it's only one that even have access to what we call supposed borehole water, which also is very compromised. And also there's challenge in upscaling services, if there are services at all. Infrastructural limitation is actually another structural determinant that shape communicable diseases among IDP. Last part of lack of proper sanitation facilities. So we look at the economic barriers, which includes the direct and the indirect costs associated with accessing healthcare. So these include the incapacity of the individuals to actually access healthcare in the camps. And what is the consequence of this? The consequence actually has to do with long-term economic consequence, intergenerational transmission of poverty. And this means that because the first generation are poor already, this translates to the second generation and further generation, therefore perpetuating in poverty. It also reduces human capital development, which incidentally is not being looked at in this context of the bigger picture. So when we talk about internally displaced people, the consequence is not only for the people, but also for the economy at large. So it's a huge consequence of not treating or looking into how to reduce this set of people and how to improve their situation. Also, so now we have just talk about innovative ways to not to leave anyone behind, because that is the crux of the SDG goal. One is we can look for initiative of cash-based interventions, look for specific vouchers that can be used. There are situations where rosters have actually been used as intervention, leverage upon for interventions. And we could also think of conditional cash transfers that can link to healthy behaviors. Livelihood support programs, skills training, microfinancing initiatives, and integration of health education with livelihood programs. Then public-private partnership is very important. This is not something that the government alone can do, but there's need for social responsibility initiatives that should take place in the IDP camps to meet the need. And in conclusion, what I will want to say is that inclusive strategies for addressing health access among IDP is very multi-sectorial. It is not just for the health sector, it is for the nutrition department, the ministry, it includes the nutrition ministry, it includes the water and sanitation. And in next step, we are thinking, apart from the ones that Prof. as Dr. Dowu has actually alluded to, is looking at implementation intervention research, where especially in reproductive health and women's health, since we've observed that almost 50% of women, pregnant women, were less than 18 years old. And that is actually, they are still adolescents, and that is a very important thing. So, and thank you. Thank you very much.
Okay.
Thank you so much for your presentation. And hands have already been up even before you finish. I saw Professor Sogolo, and I would just want Professor Sogolo to make his remarks. Professor, sir, can we hear from you? Yes, sir.
Thank you very much. I first of all want to congratulate our presenters for this very clear presentation. I thought that being not in that area, we were not going to understand some of the technicalities of their presentation, but they were all clear and lucid and very well presented. But as usual, for those of us in the arts, well, there are a lot of things we don't understand about professionals when they present their papers. I was a bit confused when the first presentation was talking about instances, and the first thing they mentioned was malaria. And I said, is malaria a communicable disease? But then I checked and found that they were right. So that was how we in the arts all the time miss this point, because other disease that is passed from one individual to another or is passed through some other sources. In this case, through some agents or water and so forth. So that was clear. But I'm still a little confused about the choice of IDP, because when I listened to all the presentations, they were almost saying that the conditions that exist in IDP also exist in many other communities. In other words, if you talk about a typical slum where you have poor water supply, you have crowded situation, you have this, almost everything they're talking now exists there. So it might look like it's a matter of comparison.
Yes,
To say in IDPs, you find more of this. And I think the last presenter was almost doing that. Alaba was almost referring to that in IDPs, you have more of this situation than many others. Now, if that is the case, that is question of more than the others, then why IDP? Why the choice of IDP? So you see, when you choose a topic, you must say that, look, there's some peculiarity about this situation. IDP offers this, which you do not find in other slums, other poor areas, or other areas of our community where you have these circumstances, or where these circumstances prevail. So I just thought that, in fact, what all it means is question of clarification, so that the presentation has to give, at least from the introduction. And because you are presenting to so many of us, some so ignorant about medicine, ignorant about this aspect of your profession, you try to define at the beginning and say, well, the communicable disease is this, a non-communicable disease is this. Because if you assume that we know, then you'll be surprised that many of us don't know. Thank you very much.
Thank you very much, sir, for that wonderful contribution. I absolutely agree with you that there's a need to make more specific definitions to carry everyone along. And you are not the only one who was surprised about malaria. It's not too long ago that I accepted it as a communicable disease, because in the days past, in the old days, nobody saw malaria as communicable. So, and they made us feel it was not, that the mosquito that bites A and comes to bite B transmits the anopheles, does not necessarily transmit the agent of malaria, does not necessarily cause it, but that is changing fast, and many people have come to accept it as a communicable disease. And I also agree that, like I was asking a question, I'm sorry, I'll call you Professor Tijani, I'm sorry. I was asking, this, and information was like, it's women that dominate the place. And I said, where are their husbands? Because I can see small children. Small children every day. And I'm sure that it's men that are responsible for those pregnancies and children. So you may need to tell us whether their husbands go to hide somewhere else and already mainly made of women, or they have 4, 5 wives, as the case may be. We need to get that very clear. Because I say, where are their husbands? So I'm interested, because I know that, yes, they have many children. I visited one of them and I was amazed at the number of children that came out. I said, wow, this is a population that we are breeding here. But where are the men? Please help us look for them. Thank you so much. Let me give Professor Tijani his turn. It's time to make his contribution. Over to you, sir.
Thank you very much. I think having researched about the IDP on a fantastic ground that I'll be speaking about, to fill in the literature and the gap in knowledge for these presenters, you probably will find those men around Galadimawa roundabout, as at the time they went there to film, to document, they will be out of camp. It so happened at the Galadimawa IDP also, even before the Kabusa one was opened. Having said that, let me comment in the spirit of our Baba, Emeritus Distinguished Professor Sogolo, whose knowledge is always inspiring, to say as follows: the intangibles and the tangibles for the presenters and for all of us, from my own perspective and little knowledge in the academia. What we see as intangible are so tangible And I think Baba has mentioned that. And the professor of earth sciences has also validated that. But one thing that I want to stress is that this is an academic presentation. I love the fact that Dr. Idowu so much like the HOD. If I'm joining at a point, I will have no clue who is that HOD. So there is a language of presentation that we need to learn, particularly for the early career colleagues on campus. And this is not limited to NOUN. It is I would say it's an African thing. I would say that. But in reference, you probably want to say, according to or as doctor or as professor, whatever the title is, Saliu has mentioned, not my HOD, I mean, that is, just not ideal for presentation, particularly when there will be people that will join you at the middle of your presentation. So the identity of that HOD, which is the name, is important. Also, for structural presentation, if I were to give a guide for the presentation, I think Dr. Idowu's paper should come first, followed by Dr. Saliu, and then, of course, Dr. Alaba will come last, and there will be a seamless flow in terms of general, global, and specificity, and of course, interdisciplinarity of the presentation. I don't know whether maybe I'm communicating, but this is what I would suggest to the three the presenters. Idowu will come first because we're going to review subject these papers if they choose to have it published in a CMGS journal. I think that sequence, that seamlessness should, and the trajectory should follow. I may be wrong, but that is my view. No, now let me make a general comment. I'm not representing your papers. The first question when I joined was to ask, when Dr. Saliu was presenting, was to ask funding. Do you have funding to go to the IDP? You may want to share with us your funding, because, I was fortunate, even as a now substantive now staff. Now that I'm visiting, I'm still enjoying, grants and what have you, from different parts of the world, because this is a topical issue. It's still ongoing. So funding is very important. I will share with you also that we have done, when I say we, it's across 7 nations in Africa. And NOUN was represented by me. But today, I can tell you that Professor Ganiat, if I call you doctor, just don't mind my American nomenclature. You are all doctor if you have a PhD, professor, so. Okay. Professor Ganiat and a few others, I can't remember their names, were also, they continue where I stopped. And initially, it was Dr. Uthman Adesina, that is Ganiat, that led us, that linked us with Craig Walker. I'm giving you the history now for context, and I will tell you where I'm going. But eventually, we got a grant from the Arts and Humanities Research Council of UK, United Kingdom, in 2018, 2019, for about, I believe, for something substantial, pound sterling. And then successful completion of that in 2020, we got 2.1 million euro. It's not money in the pocket. It's not money in the ID card. It's for research. But that research is very, very useful to what the three of you are doing. And I'll shed more light on that. So you must link up with Professor Uthman, the former Dean of Social Sciences, to link you up. You should, not must, sorry, excuse me for the use of must. I cannot command it. You should also take advantage of the Galadimawa IDP camp, All I can remember is that if you leave NUN, since two of you are within the NUN campus, and you get to the roundabout, instead of going straight to Kabusa, you head on to, you make the left turning all the way, and then the IDP camp is over there. They have a clinic. They have also primary school, and they do have NGO that work with us. I won't go into the politics of NGOs and what I saw, which is not acceptable to me, and the reason why when I returned to US, I chose not to be part of the research because they were not controlling those NGOs. Some of them see it as a money making, and they just want you as academics to sign, whatever they put. Yes, Kushingur, IDP. Thanks for saying that. So the next one that I want you to please take a look to fill in the gap in knowledge is the CEMG annual report. The moment you start talking, I just check my email. I search. And the annual report for 2020, even for 2023, are so important to what you are doing. It will fill the gap in literature, what has been done, and what you want to do. The issue is multidisciplinary. And as such, it makes your work so valid, so important. Personally, I have learned today what you have presented and what you continue to do. Also, lastly, there are two things that I must mention to fill in the gap. The last presenter, Dr. Alaba, you made mention of legality, legal. It is Dr. Toju Alero's paper will be useful for the colleague from South Africa, Dr. Alaba, looking at legal issues. The last but not the least is the project by NCRC, Nigeria COVID-19 Research Consortium. We had about 9, I'm saying about 9 because I'm not exact now, but this was a multidisciplinary consortium made up of professors in the earth sciences, in social sciences, in the arts, in the humanities, and I happen to be a co-chair of the social science research unit with Professor Jegede at the University of Ibadan. Professor Ehiro or Ehimaro, and then there's this professor, a doctor that is now somewhere in DC completing her PhD, was our secretary. But if you get hold of that report, and I can check and share with you, between 2019 and 2022 that I was fully involved, I think it will help your work. Again, I thank you for sharing knowledge. This has been so fantastic. It is all about education, is about decolonizing the project, and it's about showcasing the fact that NOUN is indeed a university to be reckoned with. And I thank you. Thank you very much for the opportunity.
Thank you very much.
Thank you very much.
Director, before
yes,
you
said you have something. More people, I will not interested in this interesting topic. I expected to have more than 2 people talk about today's presentation.
because you have spent more than 1 hour.
Because the internet has also been very, very bad, and we have been having itches. So it's good if we don't have more to say, and because the time has been overspent, are we going to call it a day? But we want to start telling the team that we are expecting them to write up this paper, and then in the following our journal author's guide, you can always, it's on the platform, our author's guide. You follow it, and then let's see what you have so that we can publish this interesting work, and very, very well health, but it affects everyone. And like we have said, to really know how to differentiate what we found there and what we find generally, like Emeritus suggested. Any difference? If it is the same, then we may be saying it's exactly the same, no difference. But if there are differences, like Dr. Alaba tried to bring out in some of the points she raised, to bring those one out more so that they can receive the needed attention, because there must be a gap for attention to be given.
Yes.
So on this note, I want to say a big thank you to all of you for being here,
Professor
Yes.
Neto, sorry.
Yes.
Please make sure they have access to that report, all the reports, the annual report, and then they can find, presentation, and also that those presentation that metamorphose into journal article to enrich their work.
Yeah, okay. I think Professor Saliu, Dr. Saliu, you'll come around and then
Yes,
you
ma'am.
have
Yes, ma'am.
whatever you need
Yes.
in our small library here in the center. Okay,
Yes,
thank you so much,
Let
Prof.
them come to the center.
Yes, let them come and take what you need, and we are always open, and so we give you what you need once we have it. So thank you so much.
Thank you very much, ma'am.
Tijani,
Thank you.
Emeritus Professor Sogolo, we thank you for always being there and being the first to come. Even no matter how hard I try to be punctual, so most times he beats me to it. So I appreciate your presence, sir, and your contribution. My speakers for today, I appreciate you all. Dr.
Thank you
Saliu,
very
Dr.
much, ma'am. Thank you so
Idowu,
much.
Dr. Alaba, thank you
Thank
for
you
the
very
good job.
much.
And
Thank you.
we want to say bye-bye to you.
Bye. Thank you.
Yeah.
Yeah.
But I don't know, do you have anything to say, Dr. Saliu, as the team leader? Anything? So that I don't just...
I just want to appreciate Emeritus Professor and everyone that participated in this discourse today. All the comments have been noted. I noted the comments made by Professor Tijani, and I'm sure we'll look at all those areas. And I feel like most people that attended today are actually benefited. Some of the knowledge we shared, especially now many people realize that malaria is a communicable disease. I tried to define it earlier, what a communicable disease is. So I guess now at least we have been able to share. And I'll also follow up with Professor Tijani concerning the documents and information concerning the IDP camp researches that he had conducted earlier. And I guess that Galadima in Mawa he mentioned was Kuchingoro, which we had also visited that IDP camp, and also discovered that most of these issues are also evident there. And as a team, we have not been really funded internationally, but we were able to get the IBR from TED Fund. And that was what Dr. Idowu was showcasing, where we are trying to develop a lafocidal compound that will address the malaria parasite at the parasitic level. So we're looking at prevention of this malaria, which is endemic within the country. So we have actually done a lot to get the plants, the natural product of the plant. We are at the tail end of formulating a compound, a dissolvable ball that can be used. And because it's naturally sourced, we expect that the cost of production will not be too high. But we are looking at actually getting funding to carry it to the next level of producing in mass this kind of dissolvable balls that are made from natural lafocidal compound extracts from plants. So I guess I will have to follow up with Professor Tijani and look at how to go further in this our research. On that note, I want to say thank you very much for the opportunity. I want to appreciate our Vice Chancellor, the Chief Host, Professor Aneto, and all my colleagues, my co-discussants, Dr. Alaba and Dr. Olufunke, Dr. Idowu and Dr. Olufunke Alaba. Thank you very much, Ma, and see you.
Right. Thank you. And
thank you very much.
Bye-bye to everyone. Have a beautiful day.
Bye.
All right. Bye.
Yes, ma'am.
Thank
Bye.
you.
Bye-bye.
Bye-bye,
Bye.
everyone.
Thank you,
okay.